In public health, we capture and gather a lot of pieces of information, and it is our responsibility to analyze, interpret that information, and share it with our partners. A population health status report allows us to do that.
I really would emphasize the importance of having, in most cases, a medical officer of health who is a real champion for it, and senior administration within that health unit as well. Without that, you really are probably not able to complete that work, and if you do complete it, it probably will not be acted upon.
Things that need to be in place to incorporate equity into all of the public health work or into some of the public health work is definitely a shared vision right across sectors. The desire and the political will and the capacity within all of the sectors, but in particular, of course, the health sector to be able to produce the surveillance, the monitoring, and the reporting. You can't use evidence if there is no evidence.
The important thing, I think, is actually that we're doing this work, that we're learning from our own work, we're improving a whole area that's really important to public health, and it's still pretty new. We have to remind ourselves that over the last 20 years we've gained access to all sorts of data, partly because of the access we have through computers. So this whole field is going to progress.
When we first started doing health status assessment, we didn't have electronic data either. And that was a difficult thing because we had, birth data that was on paper, and that had to be tabulated by hand. And so when I look now at some of our discussions, we've come such a long way. There's still concern about getting the right data, being able to link it to the right sources, and being able to match things so you can really tell the story. But we're so much farther ahead than we were just a few decades ago.
I've been around long enough in public health, doing the kind of work that I've been doing, that often people will ask me, why should we spend money on population health assessment when really we should just be taking action? We know enough now. We don't need to say anything more about what we know. We just want to take action. And I think part of being in the learning circle the last few days has also helped me realize that this is part of taking action. It is a way, a tool to change what's happening related to inequities. And if we forget it, if we disregard it as a tool in our tool bag, then we won't be doing public health a real service.
The way I've seen it over the last 30, 40 years or so is now that it really has almost, in many situations, become, again, a primary lens in a sense to look at health status. So not for everyone, though. I think it's really, to be honest, sort of within public health for sure, but I don't think it's permeated other aspects of society. Although you do see, in the last year or two anyway, increasing interest in inequity in society in general, independent of its effect on health.
Most of our public health people looked forward to getting health status report. They're just knocking on your door. Is it ready yet? Because they did use it in planning, but also they used it because they knew their communities, they knew these issues, and this was something that could help support them in what they were really trying to achieve and in relation to programs and meeting gaps.